everyone, and welcome to this edition of the Pike County Report. I'm your host, Cindy Mae Johnson, and with me, as always, is Pike County Judge Executive, of course, Ray Jones.
Thank you. It's good to be here.
Well, we're glad to be here, and we also are joined by a special guest today, Tammy Riley, who is the Public Health Director at the Pike County Health Department.
Yes, thank you.
Thank you for being here. Obviously, the hottest topic on everybody's mind right now, and we're going to cut right to the chase, is what's going on across the country, and obviously it is important to us too here in Pike County, and that's the spread of the new novel coronavirus, COVID-19.
Well, we had planned on having Tammy come on the program to talk about the role of the health department and the importance of public health, and we sort of thought it would be a good time to talk about the COVID-19, which I think they're calling the severe acute respiratory syndrome. I think this is a new term they're using for it. A lot of misinformation out there, and you've had some politicians playing it down, and you've had some politicians playing it up. And really, politics really shouldn't come into play when we're talking about something that is highly contagious, that has the potential to, with a mortality rate from somewhere between 1% and 3%, depending on who you listen to.
I'm glad you said that, and you mentioned that right before we went on camera, that this really isn't a political issue at all. It's a medical issue, and that goes across all boundaries, doesn't it?
Well, how we approach this, people in political office, government officials need to listen to people who have an understanding, infectious disease physicians, epidemiologists, people who work in public health. And we're really blessed that we have a health department that has the resources. Right now, just so happens we have a liaison from the CDC, Dr. Riggs, who is working and assigned to the Pike County Health Department. We're very blessed to have her here. We had a very good meeting. Was it the day before yesterday?
Yes, yes, it was.
We had representatives from Pikeville Medical Center, ARH, regional ARH hospital organization, a lot of local businesses from both the Pike County Board of Education, the Pikeville Independent Schools, the University of Pikeville, and we're starting to get a dialogue on how we can best address this. But if you look at the resources we have people here who understand how to deal with infectious disease, and as an elected official, that's who I'm going to look to in terms of how we move forward as a government body. These aren't political decisions. This disease doesn't know the difference between a Republican, a Democrat, or an independent. And we need to take the reasonable steps, listen to the professionals, and do what they tell us to do to try to mitigate the spread of this disease.
Well, the big thing, obviously, for everyone right now, we're sitting here in the middle of March. We're 1 month away from Hillbilly Days. And we talked about it right before we came on, that we really don't know right now what that's going to mean for Hillbilly Days. But let's talk about that. Tammy, you had an important point to make about it.
I did, and Hillbilly Days is so important to us in Pike County, and it's been ongoing for many years. And the thing about Hillbilly Days is it's so important to us, but that's really, and it's late April is when it's going to occur, and I think that's just too soon to make such an important decision. But today is the day for the community to be having those conversations. We need to start talking about it today, but it's probably too soon to be making definitive decisions.
And I think that's a reasoned approach. And I love the fact that, as you said, as the leader of our county, you're not going to be making decisions without medical guidance.
And I think I'll be working with Mayor Carter and the City Commission, members of the Fiscal Court, Ronnie Robertson, Jason Tackett, and Brian Booth. The Hillbilly Days has not been canceled. Some people are asking that question. As you know, the governor has called on people to avoid mass gatherings. The CDC has called on people to avoid large crowds. They're warning people about cruises. And the thing about Hillbilly Days is, let's hope we don't have any COVID cases in novel coronavirus cases in Pike County or Eastern Kentucky. The chances are we will. The last thing you would want is a large number of people coming into the area where this could be passed on. Statistically, I was just looking before we came on the air, someone who has the flu is likely to give it to one other person. so far they think that with the novel coronavirus, someone who gets that disease will likely pass it to 2 individuals. So it's about twice as contagious, at least is what they know now, as the common flu. And we all know that you wouldn't want people with the flu in a crowd like Hillbilly Days. Well, you certainly want you would not want someone in a crowd that has a disease that's more contagious. But we're going to monitor the situation. We're going to be in constant contact with the State Department of Public Health. We're monitoring what the CDC says. And we're, at the end of the day, your state and local officials really need to listen to the medical professionals about how best to address this situation.
And again, we've got such good resources at the Pike County Health Department.
Yes, we do.
Let's talk just a little bit about that, about what you all have pulled together and about the kinds of people who are coming together to talk about this.
Thank you, Cindy. At the Pike County Health Department, as Judge Jones referenced, we have an in-house, full-time emergency preparedness coordinator. She's an environmentalist, and she's been trained, and she's worked with us for about 14 years. And she has all of that incident command, emergency preparedness training. She works on a regular basis with emergency management in the county. They do their mock trainings and exercises, and she's been through a few events somewhat like coronavirus, COVID-19, what we're dealing with right now. And then we have a regional epidemiologist who is a Department of Public Health employee, but she's assigned to this region, and she's on site, on the Pike County Health Department's site every Friday, and right now more frequently, and I have regular access to her. And then, as you referenced, Dr. Riggs, Dr. Margot Riggs, is just a wonderful asset to have, and she is CDC representative, and she was here to work with SOAR, and my understanding is she's the only CDC in the United States that was assigned to a nonprofit. So she was here to work with Pike County and with SOAR because to address some of our disparities, like the high rate of diabetes and heart disease and COPD. So that was her purpose here to begin with. So she recently got the green light from the CDC to work directly and assist with COVID-19.
Which again, we've got some great resources here.
Yes.
And I think the most important messaging that we can probably share right now is to be reasonable.
Yes.
And Tammy and I talked about this before we went on the air as well. You're hearing a lot of don't panic. This is not the time to panic, and that's true. But what I worry about is that there is an implied possibility that there will be a time to panic. Now, you just said, for example, that we don't have any cases in Pike County right now, but we probably will.
There's no reason to panic, even if we have
Thank
a
you.
diagnosed case in Pike County.
Thank you. That's what I was getting at.
Because we have medical professionals here. Yesterday, we had representatives from our first responders, the ambulance services that serve Pike County. We have a very, very top-tier infectious disease expert in
Yes,
Dr.
we
Foddy.
do.
Great guy. He's a friend of mine. I'm very happy that he's chose to make this county his home. And a lot of communities in eastern Kentucky don't have someone with his expertise. And that's why I'm saying when we deal with this issue, if we start having cases that are diagnosed, we need to depend on the people who are going to be treating these patients and the people who have expertise on how we stop the spread. Because even if you have one fatality from this disease, it's one too many. Because the one thing none of us know, if you look at the statistics, kids don't seem to be as impacted by this as the flu. The flu can be fatal for children. You know, my wife being a doctor, we always make sure our kids get flu shots. Well, there's no vaccine for COVID-19. And what we know is the first patient that was diagnosed in Kentucky, I called the Harrison County Judge Executive, Alex Barnett, because I wanted to get some information to know what to expect. A 27-year-old healthy female, no comorbidities, because there's some misconception that this only affects older people. Well, a 27-year-old young woman ended up on a ventilator and nearly died. So this is not something to take lightly, but it's also not something to panic over. Two of the cases in Lexington I saw were males 46 and 49. So while it seems to have a more harsh impact on older patients, it's still, when you hear a 27-year-old young woman ends up on a ventilator, it's not something to take lightly. And again, we can treat the flu. We have antiviral medicines. We don't have that for COVID-19, and we just need to do everything we can. And Tammy's got some great information on the best thing we can do to stop the spread of this disease. It's something that I've been trying to get my kids to learn since they've come into the world. So,
Well, the thing, too, that he just said that is so important is that there's not going to be a time to panic. Yes,
Right.
that things may escalate, but there's never been a time in history that panic helped anything.
It doesn't help anything, no.
no, and you know, the joke going around on Facebook is everybody's buying the toilet paper up, and I'm sitting there thinking to myself, I'm not sure what the purpose of that would be. But, you know, we have state and federal agencies, emergency management agencies. If we have a massive outbreak, you know, a lot of people, the thing that bothers me, Cindy, is people say, oh, it's an overreaction. Well, you don't know if it's an overreaction. Here's a choice you make. You can sit back and you can take a sort of a nonchalant approach. Oh, it's not worse than the flu, those kind of things. And then when you start seeing the cases rapidly increase and people start to die, then it's too late. I would rather have our public health officials take a more aggressive approach and a more cautious approach on the front end, because, you know, as they learn more about this, they can make changes to the protocols or their suggestions. But if we don't get ahead of it, then it could get out of hand, and then you would have to rely more on state and federal officials.
Well, an ounce
Well,
of prevention is
worth it.
worth a pound of cure.
That's
so
true.
talk to us about these preventions that we should be thinking about.
Well, as far as preparedness, you mentioned the public health being in the forefront, and I do agree public health, their role is promote, prevent, protect, and that's what we do. And behind the scenes, we've been preparing for weeks. I mean, we didn't know about this virus until late December. And right here in Pike County, those highly trained specialists I just referenced, we've been meeting with them, with Dr. Foddy and with other stakeholders in the community, those frontline healthcare providers and individuals. We've been meeting for weeks preparing. And we have a common message, a unified community message that we want to get out to Pike Countyans, and that is stay calm. Our outcomes will be best for everyone across the United States, all communities. Their outcomes are going to improve if they stay calm, and we're prepared, so Pike Countyans should know that. So we want everyone to stay calm and clean. We want them to clean their hands. I think many people have talked about that, but you can't say it enough. It is one of the frontline ways to prevent the spread, for you to wash your hands. And I say wash them twice as often as you did before and twice as long. Now, the CDC guidelines is to wash your hands for 20 seconds, sort of like saying the ABCs or singing happy birthday. We've all heard that. So I want you to do that, but I'm saying do it twice as often. Maybe do it for 40 seconds. It doesn't hurt anything. And a really funny story that was shared to me is pretend like you just chopped jalapenos and you're going to put contacts in your eyes.
Yes.
Think of it that way when you're washing your hands. And a school teacher put a stamp on a child's hand and had them wash their hands as demonstration until the stamp disappeared. So that was a good lesson for the class to see, that length of time really get in there. So we need to be doing that at home and in the schools and teaching our kids, but all of us to be washing our hands. And those hard surfaces using the CDC approved disinfectants that we normally use at home to kill viruses and germs. But clean, hard surfaces, high traffic areas we touch. And I've really gotten the habit of using my knuckle when I hit elevator buttons, and I use my sleeve, whatever it takes when opening doors, and elbows. And Dr. Foddy and I have a new thing where we bump elbows instead of shaking hands when we say hello.
I'm glad you mentioned that because, you know, in Appalachia, we're huggers.
We
and
are.
we get in there and we get close.
I'm a hugger.
So let's talk about that a little bit.
Yes, social distancing. So social distancing is very important because some people with coronavirus, the COVID-19, the new coronavirus, could be asymptomatic or have very mild symptoms. And younger folks are going to maybe, as we talk, power through. and they may be out shopping. So that's why it's so important whether you feel like you're sick or you're not sick. And this really applies for influenza or anything, but particularly now it's important to practice social distancing. And social distancing means a good portion at 6 feet or more apart. And that's really important. So no one's saying don't go out and shop. Go get your groceries. If you feel well, go get your groceries. You know, do the normal day-to-day things that you would do, but practice social distancing.
And maybe fist bump or elbow bump
Do a
instead
little-
of handshakes.
Yes. So stay calm, clean the hands, clean the surfaces, high traffic areas, and then we want to contain. If you feel ill, stay home. If you're using, and then cover. Let's talk about cover.
Okay.
So there's some sneezing and coughing that goes along with the COVID-19. So first and foremost, you want to use a tissue and then discard the tissue. In an emergency, you don't have a tissue, you're going to sneeze or cough, you know, sometimes we just can't hold it back. Then you would use your elbow, but only if a tissue or something that you could discard is not available. Front line is we want you using tissue and discarding. This is a new virus. There's still information we don't know. We know that it's going to be on the clothes, and you mentioned the hugging. So you do this, and then you hug. There's a possibility that you could transmit. So we want Pike Countyans to stay calm, to clean, to cover, and then if you feel ill, stay home, contain. Let's don't spread it. Let's stay home and isolate ourselves. And I think we've all heard about that 14-day window.
A lot of this is common sense, don't you think?
Well, you know, fortunately, it's not hitting kids as hard as it's hitting adults because, you know, I'm always on my kids, wash your hands, wash your hands. And that's, you know, my grandmother always told me, make sure you wash your hands. And that's good advice.
Mm-hmm.
And I don't know if we can put the logo up on that the health department's come up with. If we could put that on the screen, I think that would be something just as a reminder. Tammy, just walk through them again.
Stay calm, clean often, twice as much as normal and twice as long. Cover with the tissue and discard. And if you feel ill, contain yourself, stay home. You know, we're Pike Countyans, we're in this together. So what we want to do is, if you feel ill, you may feel like you could power through, or I can go to work anyway, but really now is not the time to be practicing that.
Well, let's talk about the fact that maybe you're not in any of the high-risk categories, and you don't feel really bad, but you've got a little cough. Why is it important for that person to stay home again?
Well, because when they go to work, you're talking about an employee,
Yes.
correct? When you go to work, you don't know all of the information about your coworkers. You may be working with someone who's had a kidney transplant, or you may be working with someone who fits that category of vulnerability, which the CDC has defined as greater than 60 years or immunosuppressed, or those comorbidities, diabetes, heart, lung, kidneys issues. So you may be able to power through, but your coworker may be compromised or at higher risk than you are.
So you've got a responsibility
just
to
like
other people.
Absolutely. Just like influenza, I've talked about it since the beginning of flu season, is you may be able to be fine with the flu. You'll feel poorly for a few days, but grandma and grandpa may not do so well. And
Yeah.
it's very similar.
That's why today that they've recommended, I'm not sure if the governor's issued an order about restricting visits to nursing homes, but that's the suggestion because, you know, if this disease in a elderly population can have a horrific outcome. We saw that in what happened in Washington State. But, you know, for most young people, the one thing that Tammy keeps mentioning is that you may not even be symptomatic and have it and
Right.
carry the disease. So I do think it's important that people understand that if there are symptoms, it's important to stay home. But also, you know, the symptoms, we really didn't get to talk about that. I think the symptoms that were identified, fever, cough, and shortness of breath or respiratory distress. And the thing that's interesting is how fast that these symptoms can appear. That somebody can go from fairly healthy to having severe respiratory problems in a very short period of We want to make sure that if you do have medical problems, either call your doctor. I mean, we're not saying don't hesitate to go to the hospital if you're having significant problems, but call your doctor, get their advice. Hopefully, we can work. One of the suggestions I had is that several years ago, back when your dad was the CEO at the hospital, he came up with a great idea that Pikeville Medical Center had a flu clinic. Instead of having people with the flu coming in to the hospital where you had other sick people. And Tammy mentioned people who are immunocompromised. I was with a doctor yesterday who has rheumatoid arthritis, a healthy young physician, but he's taken a medication. I think he said he was taking Humira or one of those
probably
types
Enbrel,
of
probably
Enbrel,
Enbrel, one of the
maybe,
biologics.
one of the biologics, but it has the side effect of suppressing the immune system.
And so you would know that he was compromised.
That's right.
So you have a younger person who's on certain medications that may make them more susceptible. So it's important to realize that if you are symptomatic, contact a medical professional, particularly if you have a fever. So we want to make sure that we don't spread it to our healthcare providers, particularly our paramedics and EMTs, because they're going to be on the front lines. If somebody calls for an ambulance, it's important to let the healthcare professionals know what your symptoms are. They're going to take precautions, but again, there's a lot we still don't know about this disease.
I think overwhelming the healthcare providers is a very, very important issue, and that's one of the topics that we've dealt with extensively at the health department. And there's a 1-800 hotline that anyone can use, the general public. And it's available 1-800-722-5725, and we have that we can put up on the screen. But any general question. But what we want, and one of the main messages from a public health perspective that we're trying to get out there is this. Yes, social distancing, stay home if you're sick. But if you would not otherwise seek medical attention, don't go to the ER. If you would not, call the hotline or call your provider, get them on the phone, work through it, because we don't want to overwhelm the emergency rooms.
I think that's so important because, again, if people will be responsible,
Yes.
follow these guidelines, then we'll be able to weather whatever comes our
Yes.
way.
We're in it together.
That's right. And I think it's important for us to continue to remind people of that fact and the fact that nobody's hiding information.
That's right.
This is all full transparency. And if things change, we'll be right here to tell them about it. That's what you all will be
That's right.
doing.
That's right.
I think that after the organizational meeting we had Monday, that there was a small group, a subgroup, which is Tammy is the public health director, Dr. Foddy, who's the infectious disease physician, the Dr. Riggs.
Dr. Riggs was CDC, our epidemiologist and emergency coordinator, preparedness coordinator, the county and independent school systems, and the university. So those individuals are coming together as a subcommittee and meeting daily.
And I can speak from the standpoint of the media. We're being very cautious about what we say and how we say it, and we're taking our cue, just like you said, from the medical professionals. We want to make sure that the information that you hear and that you receive is accurate and that it does not incite panic, because again,
Right.
there's never been a time that panicking helped anything. So
I would really like to see an effort set up to create some screening centers for this disease. If the outbreak continues, keep in mind we only have, as of when we came on the air today, and people are going to be watching this, so it's Wednesday afternoon. We started about 2:15, 2:30. There was only 8 cases in Kentucky. So I mean, we're talking about something that really has not had widespread dissemination throughout the state. The experts do think that there's likely to be other cases. I'm hopeful that we can contain it, but we do have open borders. People come, people go, airports. But if it does continue to increase in terms of the number of cases, I would hope that the Department of Public Health, some of our hospitals would look at doing what your dad did in creating screening centers. Instead of, like I said, you don't want people with a highly contagious disease going into the hospital because you have people there who have other health issues, and you don't want to contaminate that facility. So that is something I hope that we can look at. And we've also been in contact with, I've talked to Rocky Atkins in the governor's office We've talked twice about trying to get a regional testing center to where healthcare providers here can get the swabs done for suspected coronavirus cases, and instead of having to send it to an out-of-town lab and wait 3 or 4 days, that we can have a quicker turnaround time. I think as of today, I saw that there have only been 54 Kentuckians. The last article I saw on Kentucky.com was they'd only tested 54 people in Kentucky. Out of 4.4 million, that's not very many people. So, but again, we don't want people to panic, and if they have questions, please call the health department.
Yeah, absolutely. You can call us at 437-5500. We are updating our website and our social media. Go to our Facebook page and like it. That's a perfect opportunity for me to address like all the fake information that's out there, fake news and
Yes.
scams and alerts. I encourage Pike County citizens to go to trusted sources, your health department, your hospitals, your government websites and social media pages. Like those, follow those. That's where you're going to get your accurate information, your local news media outlets that you trust and know. You're not going to get updated, legitimate information via mass texting and
Well, and we do want to address that. There
Yes.
was a scam text that started sometime yesterday or last
Yes.
night. It looked fairly legit, but it did not come from a trusted authority. It didn't come from the
That's
health
right.
department. It didn't come from any trusted media, and it was a scam. It was a fear monger, and we don't need that.
It was, and we have a massive following on Facebook. We have quite a few citizens that follow the Pike County Health Department. And as soon as I was made aware, and we were actually in our Board of Health meeting, we were exiting that meeting when I started getting notifications about the scam alert. And I was able to do a screenshot of the fake text that was going around. I posted it, and it was shared before I could get home, which is a very short drive. It was shared 400 or 500 times. And I've lost count now. I think it maybe was up in the 700s, and tens of thousands were reached. I mean,
So letting people know that that was a scam and was not legitimate. And again, we'll just remind people, you know who the trusted sources are.
Yes.
So just try to stay focused on that.
yes, stay calm.
Yeah.
The 4 C's.
If you go back to this, if there is a case diagnosed in Pike County, Kentucky, there is absolutely no reason to panic.
Right.
Because I'll go back to this, you have some excellent physicians in our community. We have the health department resources. County government will work with state government to address whatever problem there is. But we also want to make sure that we're just being careful, reminding people to, and if you don't have soap and water, hand sanitizer. Of course, you know, there's been a run on hand sanitizer. You know, I went to Walmart and bought some for my law office. You know, we want to make sure that people are using that if they don't have access to soap and water.
I'd like to make a point about the hand sanitizer because there's been a little confusion about that because they are running low on supplies in some places, and hand sanitizer that's not 60% alcohol or greater, that is ideal. You want because there are hand sanitizers out there that are sanitizers, but they're not alcohol based, so you want to have that 60% alcohol or higher. And of course, I know you know soap and water is our first choice, and we're talking about backup, correct?
You know, I
That's
keep
back.
hand sanitizer in my car. You don't have soap
That's-
and water there.
that's right, and
So
that's what
there
it's
are
for.
lots of applications where that makes a lot of
Absolutely,
sense.
yes.
Before we finish, I'd like for Tammy just to talk a little bit about what else the health department does. I think the outbreak of this novel coronavirus has maybe opened people's eyes about the importance of the health department, because when we all pay our property taxes, there is a line item on your tax bill to where part of your property taxes go to the health department. I think this should open people's eyes as to why that is a very good expenditure of money, why we need a health department. But
Yes, absolutely.
Tell us
Well,
about
thank
the health
you.
department.
Well, I've told my staff, you know, they are very aware that they're in the spotlight right now, and I feel they're shining. They have really stepped up. They're working hard. I want the public to know that they are working many hard hours preparing, but our goal is to prevent, promote, and protect. Those 3 Ps, and so many of the things that we do are behind the scenes, and people never know that we're doing them. One good example is the environmental department. You know, they do those sewage inspections. They do the restaurant, hotel inspections. So, you know, they keep people safe, and that those environmental factors are within guidelines and where they need to be, and they're a great resource for restaurant owners. Restaurant and hotel owners appreciate our environmentalists. They give them guidance, and it's a team effort, and they do those inspections, and that gives the community comfort. So it's a real team effort there with the environmentalists. They do pool inspections, and then we have the clinic, which is located on the first floor, and they have the vaccine for children's programs and family planning and all of those good resources that help protect and prevent. We don't see a lot of sick people because what we do is protect and prevent. So normally we're working behind the scenes to prevent things like this from happening and to give good guidance then and monitor and inform when it does.
And again, this timing was great. You shared with me you had planned to have her here just to talk about the health department before we knew we had to deal with this particular topic today about
I could
COVID-19.
talk all day. Yeah, I could talk all day about the health department. So we may need to do that at another time so I
think
can
we
brag
should.
on all the things that they do.
Well, public health, what could be more important to our community?
Well, this is where we all live. This is where we're raising our families. This is where, this is home. And the health and safety of our community is the first priority. And we have an outstanding team at the health department. And we are truly blessed because some counties don't have the resources that we have. And so when people pay their property taxes and they wonder why they're paying money to the health department, this is a reason. I want to go back to what you said. This whole idea about how we react to the novel coronavirus. An ounce of prevention is worth a pound of cure. We want to keep people from getting this disease, and if we have to be aggressive on that front end to keep that from happening, it's better than the alternative of having a widespread disease that's highly contagious making its way through our communities. Because, if that were to happen, it would affect people that you know. And none of us have a crystal ball. It could be a member of our family, it could be somebody we care about, and we want to prevent that. And go back to what we said, the 4 C's: calm, clean, cover, and contain. And we're going to keep working with the health department and our local health professionals. If we need to come back on, if things change, and
We'll
they
be
could,
here.
we'll be back on. So, but again, we'll just ask everybody to be calm. If there is a case, the one thing I think that our health professionals want to make sure is that people every time, I've had my allergies of cough and stuff like that. We want to make sure people just don't run straight to the hospital thinking, oh, I've got this contagious disease, because the chances are you don't have it. Very, very few people in Kentucky, 8 people have tested positive as of today.
I hope that our hospitals take your advice and maybe think about doing some containment of testing. That would be wonderful. You will hear from your county judge executive. You'll hear from the Pike County Health Department, and we've got a direct line. So I really want people to remember that, to trust your trusted sources. Thank you both. I think this has been a great show and an important one. And just as the judge said, please stay tuned, because if there's more information, we will bring it to you. That's going to do it for this edition of the Pike County Report. I'm Cindy Mae Johnson.